Hey, Dr. Dave here. Today we're here with Pam. Pam has agreed to talk a little bit about her experience with chiropractic care. She originally came in 37 weeks pregnant. She's no longer pregnant. But she had 37 weeks pregnant and she had a transverse lie. The reason she sought out chiropractic care was she has 4?
Yes.
Now 4?
Yes, now 4.
Now 4. She had 3 children vaginally, naturally, and she had a transverse lie. She wanted to continue the trend of having vaginal births. Came across, how did you even find me?
My husband went on a crazy internet search and just was really looking for somebody who does the Webster method, and we heard great things about you. So he called and you literally got us in that night. You understood like the gravity of the situation.
Yeah, she was wanting to be right away. We have to take care of this.
Yes.
So she came in, she did a chiropractic examination, we did a history. In the history, in addition to her primary reason for coming here was the pregnancy. And then we found out these other things as she went along in her history, such things as neck pain, headaches that you were experiencing for a long time. They were in your left eye, in your sinus, they would radiate up your nose to around your left eye.
Yes.
You would get them at least monthly, but when you get them, you would have them for 3 solid days.
Yeah.
Right, with excruciating pain at times.
Yeah.
So severe. You also said when you came in here that you had fallen a few months prior.
While I was pregnant, yeah.
While you were pregnant.
Yeah.
In Disney in the airport. I'm just going to throw that in.
I'm like, maybe not, but close.
No, she fell?
At home over a baby gate.
At home over a baby gate.
Yeah.
You turned and you described it as felt ripping and pulling in your pelvis.
Yeah. Yeah.
So it was pretty bad. You had radiating pains in the front of her legs, and then in 2011, you were in actually a pretty severe car accident.
Yeah, I was.
Hit by a drunk driver head on.
Yeah.
You were in the hospital for a month and a half. Broke your right femur, right patella, and left foot.
Ankle.
Ankle.
Yeah. Metalis.
You did have surgery on that, and then you said something interesting. For a while, you were walking on the outside of her foot. She was walking on the outside of her left foot. How long were you walking like that for?
I mean, since I started coming here, my entire gait in my legs, or like the way that I walk in general, was just completely different than how it had been my entire life. So
the accident was in 2011, and since 2011, she was walking on the outside of her foot after after a month and a half of being in the hospital. So she's had an interesting history, and then she presents here with pregnancy, 37 weeks pregnant. So we started adjusting you. We did her analysis. We did, because she was pregnant, I couldn't do x-rays on her, so I can't show you those. What I can show you is we did this scan on her, and we haven't done a follow-up yet. And the scan just shows stress, tension, irritation in her nervous system and in her muscle system. So in this bottom one here, this is a normal representation of a muscle scan. The tension along the spine, the muscles along the spine. It's pear-shaped, it's white in color, and it's even. That's its ideal, that's normal. And then this was Pam's scan. The colors indicate stress, tension in her muscles. So green is mild, blue is moderate, red is severe muscle tension. And then because she doesn't have a pear-shaped here, these lower back muscles are weak, they weren't supporting the spine enough. This one is showing imbalance in muscles, which side's pulling harder. So the arrows indicate which side is pulling harder along the spine. You can see these arrows. This is her right side, then it switches to the left, then to the right, then back to the left, then back to the right. So this is her muscle system showing imbalance, weakness, stress, tension. And this is stress in her nervous system. This is done by thermography. All of these things are non-invasive. They don't hurt. I didn't torture you too much, right, through these?
it wasn't that bad.
No, it wasn't that bad. And the colors, again, show stress in the nervous system. This is the brain-body connection. This is how the brain communicates to the organs. So the colors indicate stress, tension, irritation within the nervous system. Now, we don't want stress and tension in the nervous system because we want clear communication between the brain and body. So she has a significant amount here throughout her whole entire neck. into the mid-back, and down even in this area. So these areas go to different areas of the body. So for instance, upper neck, headaches, sinus problems, allergies, difficulty sleeping. C3, 4, 5 could be neck pain, but also that feeds the diaphragm, so it can affect breathing. C6, C7, neck, shoulder, thyroid gland, T1, T2, T3, heart and lungs, T4, digestion, T9, stress hormones, cortisol levels. So we can relate this to, too, how our body is functioning physiologically. So this is basically a live shot of how her body's functioning at the time she came in. And the goal is, through care, is to improve these. You want to see these normalize and get better. So these are good. So it gives a way to show the patient how are they going through care. How is their body healing? How is it changing? Not just how you feel, because a lot of times just how you feel could be misleading as to how healthy you are. So we did an evaluation on Pam. We did a combination of chiropractic evaluation through posture analysis, through palpation, it's called, feeling, seeing her range of motion, all these other things. And I came up with the fact that she had various misalignments in her spine, neck, mid, lower back. But we were doing focusing on her pregnancy. So we're doing something called Webster's in utero constraint technique. And the whole goal of that was to try and take stress and tension off the uterus, realign her pelvis, get her pelvis in a better alignment, because even she said it felt like her pelvis was out of alignment, right?
Yeah, it definitely did.
So the goal was to try and get her pelvis back in alignment or in better shape so her body can handle a delivery. Take stress off the baby, the uterus, and allow the baby to turn. So that's done through a leg check. You look at a leg analysis. You feel for the pelvis, how it's moving. Anything that's not moving, it's called a subluxation. We want to adjust that area. Then we would turn her around, and we would look for trigger points in her abdominal area around a round ligament and try and release those. And during those simple things, by adjusting her pelvis and working on the trigger points, eventually you were able to go and have a vaginal birth, right?
Yeah.
So describe the whole thing. You were getting adjusted, and then they helped you along when your water finally broke.
Yes, well, the baby was transverse. The baby was transverse, so the baby was sideways, and just by coming here, yes, you're doing all the different pelvic things. By coming here, I would say 3-4 times a week for those 2 weeks until my water broke. I went into the hospital, and they were able to just easily turn the baby. There was enough room in my uterus, even though time had passed, that they were easily able to just barely turn her and keep her in that position, which was exactly what needed to happen. It didn't even hurt. Normally, it's something that they would give you an epidural for, but I didn't need one because I had already, I guess, with all the work that we had done here, it had, worked wonders for me. So it was awesome.
In addition to that, she noticed, I'll point these things out too, you told me, your neck pain got better, you weren't getting headaches.
I never got another headache again.
I got a headache, and you
they were debilitating, they were bad.
And your sinuses, you said you were able
to instantly
go out and breathe. She smelled stuff.
Yes,
and then she didn't react to it, and some of it you said you normally would react to certain
like people
things.
Cutting grass and different things like that. It was definitely a trigger during pregnancy. And just knowing that normally I would feel everything close up, and I knew I was bound to get a headache that would even put me in bed for a couple days. It was amazing to know, to feel, and it not happen. So yeah, it definitely helped 100%.
And in addition to that, the foot you were walking on abnormally since 2011, it's 7 years.
Yeah.
Is now she's walking normally.
I walk normally again, just from that time of adjusting my leg, which I felt adjust my knee and adjust my hip all simultaneously. That pop in itself has me walking completely fine now. I don't even fully realize it until I'm bending down with my kids and I'm able to just stay in that position for a long time, and it's not something that I stand back up and I'm in extreme pain, or I can't get back up and I'm grabbing onto things. I now just bounce up, which is insane because my ankle, I was told that it was possible I would walk with a limp for the rest of my life. So for me to now walk in a completely different manner, how I did when I was younger, is kind of why I call him a miracle worker. That's exactly why, actually.
Not really, but
you work in miracles.
I'll take the compliment, but well, we say it's what's supposed to happen when you start getting the body in better health and better alignment. things just start to get better. You know, it's about improving function. When you improve function, things start to get better. Sometimes they get completely better. Sometimes they get percentages better. But in our experience, they get significantly better. So she's had a really cool experience so far with chiropractic. She came in, her first visit was October 15th. Today is December 7th, and this is her 10th adjustment. She's only had 9 adjustments. Today will be number 10. And in that short amount of time, short amount of visits, she had a lot of life-changing experiences, where now she just goes about, you probably don't even think about this stuff, right? And
I mean, I noticed the moment that I feel any type of pain, I'm like, I need to go see my chiropractor because he can fix this.
So being a mom with 4 kids, you're busy.
Yes, and my back gets thrown out in certain places a lot.
Right, so she's still not done. I mean, she's only had 10, this is her 10th visit. We still have work to do on Pam. We'll be doing x-rays, I think, in another time, since we weren't able to do those. And maybe we'll revisit you at that time and show everyone your spine, what's going on in there. But what we will do is now demonstrate, we'll adjust you.
Sure.
Cool?
Yeah.
So, come on over here. We're going to do this in a fun way. I'm not going to be so clinical. Is that all right? All right. And we can be natural here. Right?
Yeah, absolutely.
All right, so I use this scope. This scope's called a nervoscope. And what it does is each visit on a patient, it helps me. By the way, she's a huge Disney fan. That's what this is. So,
yeah.
You know, and so am I. So it's awesome that we get to talk about Disney sometimes. But so this is a nervoscope. And so what it does is it reads heat patterns. And what I do is I run it down the spine. And what I'm looking for is that needle over there to move. So if there's an imbalance from right to left, the needle's going to give me a little sign. It's going to go one way and then break back to another. It's called a break analysis. So you can see it moving. And right about there, I get a reading. So I use this little skin marking pencil. I put a mark there so I could go back to that. I want to check that out. And then we're just going to So Pam did say that her lower back is bothering her today, right?
Mm-hmm. It has been, yeah.
So it's not a big reading down here, but I get a little movement here. So I poke around. Tender? Not necessarily.
Not necessarily.
And I'll check her neck. Okay. So I found my initial segments, and then we're just going to feel. I feel for mobility. So I compare left to right, feeling her upper neck. I could bend into the left here, but when I try and bend into the right, it's stuck. One of the components of a misalignment is the segment gets stuck. It doesn't move properly. So I know she'll feel this. When I go to the left, you go this way pretty good. When I go this way,
yeah.
Feel that? So it's stuck. The muscle up here is in spasm, right at the base of her skull. I'm going to make her cringe a little bit just because it's fun to make her. Feel for rotation. So she has limited rotation to the left. I can bring her this way here, and when I'm isolating up here, she doesn't have the same full range of motion. And then just feeling the scalene muscle here, scalene muscle tighter. I'm going to torture you a little bit just to make them laugh.
Help them understand,
Yeah.
hopefully.
Then I go down to the segments I was feeling here. Feel the same thing. I feel for spine not moving correctly, and it's not moving to the right side. She's got spasm there. I'm going to push and make you make funny faces again. And same thing here. So feeling for lower back, sacroiliac joints, left side, right side. This one's clearly locked up on the right side.
Mm-hmm. That's right.
It's not moving at all. So C1 right, round T, 1, 2, 3, 4, 5, 6, T7 on the right side, and then right lower back. All of our things are on the right side so far. So we're going to go to this table first.
Face down?
Face down. And she can't quite get up there, so we'll make fun of her height. Just kidding. We'll scooch her up when she gets down there.
You know, I have to like pull myself up every time.
Better. So I do a few things, check some other stuff. I look for leg length. Her right leg is shorter than the left here, just to get an idea. Sometimes when her pelvis is out of alignment, it'll create a leg length discrepancy. One leg is shorter or longer than the other. So her right one is shorter here. And I just bring it up, just getting a sense of what kind of tension she has in her legs, what kind of tension she has in her quads, what kind of tension she has in her pelvis. Her right one wasn't going up as far. I felt more tension in it, so it's this whole right side. So we'll start with this one over here, right at the base of her castle. So if she makes really weird noises and grunts, we won't make fun of her. She may. She may not. Oh my goodness, it's making noises already. But that didn't count because I didn't get to set it there. So we're going to lean and push. Alright?
Holy moly.
So that was T8. Then I check knees. Glide of the fibular head. So that's not gliding like it should. This one's gliding better. And then how I adjust it is I get right on the fibula head. This one already moved actually when I just did that. So get on the fibula head, and when I bring it up, and then I push this way and set back down that way. Same thing over here. They could use this in different ways. Sometimes I use what's called a speeder board. Sometimes I use my hand. And then in some cases, when people have knee problems and they can't fully get range of motion there, sometimes I'll use an instrument on there if the person has certain knee issues or has restriction of range of motion. This is called a speeder board. Just helps with speed. It's going to get right on the fibula head again. And I can feel those are gliding better. He's being such a good sport. Usually she's loud and obnoxious. And
thank you.
I'm just kidding. She's actually extremely sweet and nice. No, she's been nothing but nice, sweet, pleasant, and always laughing when she's here. She's got great energy.
I walk out of here a different person. Amazing.
And our kids are awesome. They're very well behaved. They're cute as a button. There's one around here. She's so good. She's just kind of hanging in the room over there.
Say hi.
You doing good? You're doing awesome.
It feels great. I look forward to coming here.
This is like the slow motion adjustment today. So again, feel knees. Feel for how the knees are moving. So what are you up to after this today? Tell everyone what you're doing, what your day's like.
Sushi.
Sushi?
With my baby girl.
Oh, what kind of sushi?
Well, she wants
You like
hibachi.
sushi? Wow.
Then we're gonna get our nails and go see Mr. and Mrs. Claus for dinner. Just an average
Nice.
Friday in December. Right, baby?
So I feel for talus, top of the foot. This one feels a little off. Now she has had surgery here. She has screws in her foot. So, right? You have screws still?
Yeah.
So here's a scar. This is from her surgery. And we still adjust this. This is not like a contraindication to adjusting. It's just you have to be aware of it and adjust it a little different. Just feeling for foot range of motion. You see, this piggy went to the chiropractor. And so I just get some proprioceptive pull in here. She's blinking out the toenails today, so. So we're going to adjust this cuboid on the outside. So I grab the cuboid with my thumb, stabilize this, bring it here, and then I'm going to pull. And
that's the one.
I don't know if you heard that pop, but it popped. And by the way, the pop or the crack is just a gas release, all right? It lets us know that we move something and there's a gas release. We're not actually breaking or cracking things. Same thing on that side. There are times I'll just I love your necklace. Look at those. That's gorgeous. This I just get under the base of our occiput, base of the skull, where muscle attachments are, and just try and release and relax these muscles. If I really want to torture her, I'll get on these suboccipital muscles and
Oh my goodness.
I'll dig in a little bit. And she's being really good. She doesn't want to yell.
Oh my goodness.
And they say, oh my goodness, it feels so good when you stop.
Yeah.
So now we're going to adjust lower back. Lower back's usually adjusted on the side lying table. This is a right sacroiliac joint, right ilium that's not moving, so we're going to adjust her right ilium. You can come over here if you want. You can come hang out.
Dad, you can go see Mommy. Go ahead.
Do this, I get my hand right on the ilium. One more.
Oh my goodness.
Good job.
That's always the one.
Then we're going to go back to this chair.
Yeah.
Doing awesome so far.
Mm-hmm.
Yeah, definitely feels a
This
lot
is
better.
a strap. So to promote safe adjusting here. So we're going to adjust her right atlas, top right neck. So, you're going to bring your head to the right, look up towards the ceiling, relax everything.
Whew, jeez. Oh, my lord. That was a winner right there.
Then I chest, check. Fingers, see what's going on with her wrists. Then I recheck. Check for how it's feeling. So that upper right's feeling better. Feel how it moves. And voila.
I'm a new person.
She's clear. That's basically chiropractic adjustment.
Mm-hmm.
What we'll do is we'll take her x-rays, do a re-exam, and then follow up in a future video just to show you the comparisons of where she started, where she is now, and how she's improving. So thanks for being a good sport today,
Thank you.
and we'll see you soon.